This is a Chronicle podcast, bringing you ideas in the service of medicine.
From the Chronicle podcast system, this is a Skin Spectrum podcast. It's Yadav on Acne, with Dr. Geeta Yadav. Based on recent publications from the clinical literature, Dr. Yadav provides brief synopses of recent significant clinical developments in acne research, and provides her observations and comments to accompany each report. In each episode, Dr. Yadav will answer questions and offer her expert observations and anecdotes on treating this disease. If you have a question for Dr. Yadav, or want to be in touch at any time, just send an email to yadav@chronicle.org. That's YADAV@chronicle.org. And, if you attach a voice clip, we might even use your question on an upcoming episode. Support for this podcast comes from Cipher Pharmaceuticals. Cipher is a specialty pharmaceutical company with a robust and diversified portfolio of commercial and early to late stage products. Cipher currently markets dermatology products directly in Canada and indirectly through partners in Canada, the US, and South America. Visit them at cipherpharma.com. And now, here's John Evans.
Thanks, Leona. Welcome to the third episode of Season 2 of the Yadav on Acne podcast with Dr. Geeta Yadav. I'm John Evans, Senior Editor at the Chronicle of Skin and Allergy. In this episode, Dr. Yadav will talk about preventing and managing acne scarring. Our first study is from a group of researchers from Iraq and published in February. They found that combining automated radiofrequency microneedling with isotretinoin treatment in managing moderate acne resulted in quicker improvement, less scarring, and less recurrence than isotretinoin treatment alone. Welcome, Dr. Yadav. What are your thoughts on radiofrequency microneedling as an add-on treatment to reduce acne scarring?
Thank you so much, John. I'm really excited about this topic of acne scarring as well as treating acne in and of itself, because these two often go hand in hand, and being able to kind of manage them both effectively is, I think, part of what patients are looking for when they often see a dermatologist to help them with their condition. So in this paper, the authors talk a little bit about how high sebum excretion is one of the main reasons behind the pathogenesis of acne, and that non-ablative RF microneedling treatments can lead to improvement of acne by decreasing the production of sebum through heat causing damage to the sebaceous glands. And in this study, this non-ablative RF device that was used caused injury to the sebaceous glands and was believed to be part of what drove some of the effect behind decreasing sebum production and therefore acne presence.
Our next study is from the June issue of Dermatologic Surgery. In this paper, the researchers compared the results of acne scar treatment using a hyaluronic acid filler composed of complexes of high and low molecular weight HA versus a traditional cross-linked HA filler. They found the mixed weight filler took longer to produce improvement, but resulted in overall better improvement. In your experience, Dr. Yadav, what do patient preferences regarding speed or completeness of scar improvement look like?
Well, I think what's the most challenging thing about acne scars is that there's a whole variety of them. Classically in our textbooks, we talk about the different shapes of scarring, boxcar scarring, ice pick scarring, and certainly different types of acne scars can respond differently to scar treatment modalities. I personally find in my practice that a multimodal approach is what works best, that you can do a variety of acne scarring treatments that have been tried, tested, and true in terms of TCA cross or other supportive therapies. In this study, looking at scar treatment using high and low molecular weight HA versus traditional cross-linked HA suggested that there might be a difference in terms of collagen stimulation for the patients receiving the mixed molecular weights, and ultimately resulting in better acne scar volumes and better sort of outcomes. There were no significant differences noted early on in the study, but as you mentioned, they did come a little bit later on. And this might be one way to kind of think about how acne scarring can be, again, approached with these kind of multimodal treatments. I do find that collagen filler on its own is often not sufficient, and you do need to address the different layers of the skin where that scar exists, including the epidermis with energy-based devices. But this study just kind of looked at those different kind of filler approaches to sort of show that it's possible maybe a bit more collagen stimulation will result in a more delayed but durable result.
Our last study today from the June issue of Skin Research and Technology is a literature review looking at the prevalence and risk factors of acne scarring. Researchers found that 47% of acne patients experienced scars. They also identified 3 risk factors: male gender, a positive family history of acne, and acne severity. Dr. Yadav, what are your thoughts on this paper and the findings?
Well, this is a meta-analysis, which comes with all the caveats that meta-analyses, should come with. But basically, it was a pretty large search looking at the prevalence of acne scars in patients with acne, and ultimately kind of pooling some of that data to talk about your point, which is that the prevalence of acne scars is quite high, almost half of all patients, and that this kind of pooled value is similar to previous studies on very large populations. Researchers found that a positive family history of acne increased the risk of acne scars, that it did have a heritable trait to some degree in certain patients, and that genetic factors can play a role as such in acne scarring. They also found that prevalence in mild, moderate, and severe acne, as one would expect, the scarring varied, being lower in patients with mild and obviously more significant in patients with severe acne. Some of the other highlights from this study were that prevalence was a bit higher of scarring in men compared to women, and that the types of scars that men experienced was a bit different than women. Also, that the prevalence of acne scars in adult patients was higher than non-adult patients, so almost double at 60% versus 32% in the non-adult acne group. So a couple of neat sort of findings in terms of risk factors for patients who suffer from acne scarring. And I do think, again, one of the themes we've kind of gone back to over the last couple of podcasts is around the importance of being able to identify the sequelae of acne when assessing a patient for the severity of their disease, and then making a decision about what treatment options are appropriate for them. To get another perspective on today's topic, I reached out to Dr. Sonia Abdullah, who is a recurring guest on this series. She's a Toronto-based dermatologist at Dermatology on Bloor, as well as an expert in medical and cosmetic dermatology, particularly notable in the area of acne treatment and acne scarring. She's got a lot of experience and has been a key opinion leader in this space. She's also recognized as an expert in the use of her cosmetic injectables, and we wanted to get her take on scarring and acne treatment.
So when looking at injectable treatments for acne scars, we're going to be looking at atrophic scarring in particular, largely distensible acne scars. So scars that flatten out when we distend or stretch out the skin. And hyaluronic acid is a good option for treating scars, especially if patients are already on treatment, including things like isotretinoin. And where I find hyaluronic acid treatment for acne scars is most successful is when it's used in combination with subcision. So subcision that will break up some of that scar tissue that is tethering the scar downwards. So breaking that up, whether it's with a blunt tip cannula or using a needle almost like a bayonet to break up that scar tissue, can be helpful. And then laying down the hyaluronic acid underneath the scars, again, to just raise them closer to the surface. From a safety standpoint, these are molecules that are totally reversible, and they may play a role at a cell signaling level to improve not only things like skin texture and hydration, but may actually improve collagenesis over time. Most patients using hyaluronic acid for treatment of acne scars will require maintenance treatment. Again, so important to set expectations around the degree of improvement we can achieve and what the maintenance plan would be. For some patients, we'll go beyond hyaluronic acid injectables and also tip into the world of regenerative medicine and biostimulation. And I also like using molecules like calcium hydroxyapatite or polylactic acid, again, laid down almost as a scaffolding once the scars have been subsidized to promote collagen production and over a series of sessions to improve the texture of the scars.
We turn now to a segment where we discuss acne myths and trends that are prevalent on social media. Use of ice or cooling for acne seems to be common on TikTok. It's Princess says she rubs ice on her face before spraying it with a chilled saltwater solution. And Melissa Latari says she saw good improvement from soaking her face in a mix of ice water and cucumber a couple of times a week, while also cutting sugar from her diet. Dr. Yadav, what are your thoughts on chilling the face this way and acne?
I think the jury's still out in terms of the impact of diet on acne. And though there's some evidence to suggest that foods that have high glycemic index can exacerbate acne, that may be some of the benefits that this patient is seeing. I usually reserve dietary changes for patients that really have severe acne as something else that they can do to add on to their treatment regimen. In terms of ice water and cucumbers, well, we talked a little bit about the benefit of cold showers related to acne treatment. And this is kind of the same principle that both using ice water or cucumbers can have a cooling effect on the skin, which might slow the sebum production to the skin. It also can help by reducing the inflammation temporarily. I would also say that this by itself is probably not totally sufficient to treat the underlying cause. And so these might be good adjuvants, but a real medical treatment is probably where I would advise my patients to go.
Academic Bird 4 on Reddit says they suspect that not drinking enough water contributed to their acne breakouts. What would you say to that?
It's definitely good to drink water, especially in the summertime, to stay hydrated. But in terms of whether or not that would actually change the acne prevalence, I'm a bit more skeptical. The skin and the body is fairly good at creating homeostasis in terms of being able to supply enough water to the organs that do need them. So short of being actually severely dehydrated, it's probably unlikely that drinking more water is necessary from a health benefits perspective, because most people consume sort of a fair bit between their food and drink during a day. But whether or not that would make a difference to their acne, I'm skeptical. I think that might just be a coincidence.
Jaded Flower on Reddit said that based on other social media posts, they tried dermaplaning for their acne, only for it to negatively impact their skin. Though they did say they'd seen others achieve good results with this approach. Is this the right approach for any patient? And if so, which patients?
So dermaplaning is a technique where you use a razor blade to actually take off the top layer of the epidermis to help sort of basically create a physical exfoliation, a surface that maybe is a bit more responsive to topical products or to topical treatments or energy-based devices. Dermaplaning can definitely improve acne breakouts in terms of that exfoliative property that can have, so it can kind of reduce the congestion inside pores. But I've definitely had patients respond, that they can experience breakouts later as the hair sort of grows back on the skin. I would say it really does depend on the patient. I've seen excellent results of using dermaplaning combined with other cosmetic treatments for acne. It really does depend on the patient.
Thank you, Dr. Yadav. Listeners, if you have comments or questions for Dr. Yadav, send them over. Send an email to health@chronicle.org. Add a voice clip attachment to your questions, and you might appear in a future episode of this podcast. If you enjoyed this podcast, please share it with your colleagues. You can subscribe at Apple iTunes, Google Podcast, or wherever you get your podcasts. This podcast is produced in cooperation with Cipher Pharmaceuticals, Inc. I'm John Evans, Senior Editor at Chronicle Companies. Your host has been Dr. Geeta Yadav, Founder and Director of Facet Dermatology in Toronto and a general, medical, and cosmetic dermatologist. We'll talk again next time.